Good day, welcome to General Medicine, and I'm going to discuss liver diseases. Recognizing liver disease by history taking is important because of drug toxicity. There's a possibility of drug toxicity because when there's a liver disease, the metabolism of drugs is reduced. Secondly, bleeding and bleeding tendency because of the decreased production of clotting factors and prothrombin. And thirdly, because of viral hepatitis. Points in the history that can draw our attention that there is a liver problem. Number one is hepatitis. 2, history of jaundice, bleeding tendency, cirrhosis, liver tumors, reaction to medications, liver surgery like transplants, and familial disorders. The viral hepatitis. Hepatitis A is transmitted via fecal-oral route and has a 3-week incubation period without a carrier state. In hepatitis B, it's transmitted by blood-to-blood contact via contaminated sharps, incubation period 6 weeks to 6 months. Small proportion of patients become carriers associated with chronic active hepatitis and then cirrhosis. Hepatitis C from contaminated blood transfusion, and hepatitis D or delta is a viral RNA associated with hepatitis B and demonstrated in association with hepatitis B core antigen. Other viral causes of hepatitis include cytomegalovirus, herpes simplex, Epstein-Barr virus, and Coxsackie-B virus. Diagnosis of hepatitis B. The first manifestation of hepatitis B is an increased hepatitis B surface antigen. Protection from infection. This can be demonstrated by the presence of antibodies to hepatitis B surface antigen. Evidence of infectivity can be demonstrated by 2 markers, the hepatitis B core antigen, which may persist for 1 to 2 years if hepatitis B surface antigen is negative, and hepatitis B E antigen, which is only with positive hepatitis B surface antigen and appears during the incubation period. The presence of virions in the serum can be demonstrated by DNA polymerase called polymerase chain reaction or PCR. Dental consideration in hepatitis B. Dental students must be immunized against hepatitis B, and hepatitis B vaccine called Engerix-B is injected into the deltoid muscle and is repeated at 1 and then 6 months. Poor responders are the old people, old population, and smokers as well as males are poor responders compared to females. The anti-hepatitis B surface level is below 100. If it is below 100, this is not enough to provide protection, and here a booster dose is required. Efficient cross-infection control to minimize the risk of developing hepatitis is very important. Bleeding tendency in liver diseases. It is important to suspect and inquire about any bleeding tendency, and testing of clotting factors is required. Causes of bleeding tendency in liver diseases are number 1, the poor absorption of vitamin K, and number 2, decreased synthesis of clotting factors. Vitamin K is required to form the clotting factors. It's required by the liver. Management of the bleeding tendency is by giving vitamin K injections. Liver transplantation. If we receive a patient who has done liver transplantation before treating him, I have to consult the patient's physician. No elective dental treatment for the first 3 months. General anesthesia and dental sedation, if needed, must be carried out in specialized units, as small doses of anesthetic can lead to hepatic coma. Liver cirrhosis. In liver cirrhosis, the architecture is irreversibly destroyed by fibrosis and by the formation of regenerating nodules of hepatocytes. The causes mainly unknown. Alcohol related in 25% of cases, hepatitis B or C, and chemotherapy drug. Methotrexate may be implicated in the liver cirrhosis affection. Autoimmune primary biliary cirrhosis primarily in females. Liver cirrhosis or liver fibrosis with portal hypertension and esophageal varices. Obstruction of the portal blood flow inside the liver leads to portal hypertension with the formation of esophageal varices, which are enlarged blood vessels, and the risk of gastrointestinal tract hemorrhage, hematemesis. And chronic bleeding may lead to anemia. Clues to liver disease: Dupuytren's contracture, palmar erythema, leukonychia, finger clubbing. This is the normal finger, of course. Flapping tremors, jaundice, spider nevi, ankle edema, ascites, scratch marks, gynecomastia. This is ascites and ankle edema. This is how to test for edema by finger pressure. Drugs and the liver. Aspirin is not given to children below 15 years of age due to the risk of fatal rise syndrome, which is liver damage and encephalopathy. Paracetamol dose should be reduced as this drug is hepatotoxic. Sedatives and general anesthesia are dangerous in liver disease due to impaired detoxification, and even the dose of the local anesthesia must be reduced. Thank you very much.